The way that most people think of a muscle strain is when the muscle gets stretched beyond its normal range. A muscle comprises of what we call contractile elements, the bits that move in and out of each other in order to contract the muscle and relax the muscle. And these contractile elements are suspended in a framework of non-contractile tissue. In other words, like the tendons that are at each end and within the muscle that transmit the forces of the movement of the muscle so that the limb moves. The muscle contracts, the forces go via the tendon, and the limb moves. When a stretch gets beyond the range, the normal range of the muscle, then obviously it's going to damage. Any material that you have, if you keep on stretching it, it gets to a limit and then tears. Muscles are exactly the same. Muscle strain classification is really there to help us with prognostication. In ordinary language, that means that it helps us to predict when a player may get back to playing and training. None of these systems are foolproof, but they give us a guide. And most of the modern ones are based on scan results. In other words, you look at the player, you look at the scan, and this gives you a good indication of when a player may get back to training and playing. The traditional way of grading muscle tears is based on a surgical model and was instigated before we had sophisticated scans like we do now. Grade 1 is disruption of between 0 and 5% of the muscle fibers. Grade 2, between 5 and 95%, and grade 3, between 95 and 100%. And you can see this is a relatively imperfect way of grading because most will fall into the grade 2, but a 10% grade 2 and an 80% grade 2 aren't the same strain. So the more information we have, the better we can classify. So the symptoms of a muscle strain, in other words, what the player or athlete is feeling, are pretty straightforward. A typical classical textbook history is where a player is running and feels something go, inverted commas, in their leg or their arm, can't carry on. And the most important thing is to take that history. So if you're seeing a player in your clinic and you're not at pitch side, ask them what happened. What went on when they started feeling their pain?